Welcome to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey. Good evening. How are you, sir?
Spectacular.
It's always good to get together on a good Tuesday here at Neck of the Woods.
Yeah.
As the tap room here is filling up. We're back. I feel like
Sixers are undefeated.
Sixers are undefeated. What a wild time to be alive. Let's bask in the success while it lasts.
Right.
Before we go ahead and go deep diving into our tonight's show, just want to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. From runners, knee to dog walkers, hip to yard work, back and laptop wrist, they have a doc for that. So find the right specialist for you at virtual.org/ortho.
Right.
So tonight, for anyone who follows most major sports, I think it's kind of an easy guess of, everybody.
One glaring injury.
One big old injury that we have to cover tonight. From the most recent Eagles-Giants game with the running back Cam Skattebo. Went down with a pretty wicked ankle injury.
Yeah. It was one of those gruesome ones. I'm glad they learned from Joe Theismann way back when, not to like show it over and over again. But yeah, it was one of those gruesome injuries. I think it's very in the sort of public eye for a few different reasons. One, this guy exploded onto the scene, right?
Yeah,
like
100%.
everyone's been like kind of amazed when everybody kind of kept saying the same thing, like how long can he last running like that?
Like that.
I don't know. I think a lot of us all thought like it's only a matter of time before he has a concussion or something or other. I don't think people were really thinking about this type of an injury as the one that kind of brought him down.
Right. Like everyone would suspect that his style of play would lean to something else other than a very wicked-looking ankle dislocation.
Oh, yeah.
And it's like it happened in a non-typical style play of him. He was kind of running around and kind of got tackled from behind kind of deal versus like he wasn't trying to run right through someone's
Smashing
chest.
people. Yeah.
Smashing people, right.
Yeah, just a crazy injury happened in like prime time. And anytime you have those like kind of gruesome injuries like that, it seems to garner a lot of attention.
Yeah.
And, maybe we're biased because we're in the thick of it here, it's Eagles game, everybody's talking about it and everything. Maybe across the country, it's not getting the same kind of attention, but it's Cam Skattebo. I don't watch enough college football. I really don't. I grew up in New York, and for the most part, you watch your professional sports, right?
Yeah.
And there aren't really good, like big college programs. Upstate New York, Syracuse is pretty good. Like there's a few, but it's not. You watch professional sports, and so typically that's what I had done growing up. And for whatever reason, I tuned into last year the Texas Arizona State Peach Bowl game, and I was blown away by this one guy who just did
everything,
right? And I was like that guy could be interesting,
right?
And sure enough, he winds up on the Giants. Sure enough, that's Cam Skattebo who just lit it up.
Yeah.
So exciting, so interesting to see where that was going to go. Not that his career is over. I guess we'll talk more about that.
Right.
But pretty gruesome end. I think everybody was intrigued by this guy, the running style, what he can do, and just like the way he turned almost a whole franchise around overnight.
And I think to couple that too with Jackson Dart getting the start.
Yeah.
Taking over the job from Russell Wilson
And looking
after a
excellent.
not so great start.
Yeah.
Did really well. And then the first time they did play the Eagles a couple weeks ago, they both lit it up. They did well, and they beat the crap out of the Eagles.
Yeah, without their superstar wide receiver,
right,
who they lost for the season.
Who's also been out, right, who's also tore his ACL and is also out for the season. And then I think I was talking with the owner here before, and he was a Giants fan. So he goes, I know what you guys are talking about already. And I was like, oh, how'd you know? And he goes, as a Giants fan, I get it. And I was like, yeah, it's just unfortunate that, you guys have all this young talent, and all of them are getting injured. And it's
crazy.
And it's not – now this one, I think a lot of scrutiny has been put on the MetLife turf for a lot of serious injuries.
That's a good point.
This happened at Philly.
Good point, yeah.
Not at
Not
the
at
link
MetLife.
where it's not at MetLife.
Yeah.
I think they made it through MetLife. The MetLife game fine, but just super unfortunate to see someone with so much high potential and, those two guys kind of bringing that franchise some energy, some young energy, some young, really good young talent too.
Yeah.
And then to see something like this, as much as you want to be a heavy sports fan and you have your rivals, you never want to see kind of the great players go down with something as gruesome as this.
Sure. Yeah.
There's not an injury you want, but let them just roll, do an ankle sprain or a little knee sprain, something and they kind of come back next year or next week and they deal with it. You don't want to see a significant season-ending injuries for guys like that. That's just unfortunate.
So and we had Dr. Brandt on not very long ago, a few weeks ago, right? And we did a little roundup of a bunch of kind of foot and ankle type injuries, and one of those was James Conner Connors.
James Conner, yeah.
And a little bit of speculation on what exactly happened in that injury. Was it an ankle injury? Was it a foot injury? Subtalar dislocation. What the heck's the other one? Midfoot. The
Liz Frank.
Liz Frank. Liz Frank fracture dislocation. Or was it actually ankle? I guess it's a good time for us to remind the world that we don't have access to any of these individuals' medical charts. We don't know their specific treatment. We just take the kind of public knowledge out there and just kind of talk about these types of injuries as opposed to their specific situation individually. So, the initial report for James Conner was ankle, and then it turned out maybe it was, but we never really found out, but probably something a little below that foot, subtalar or something. Right. This one, similar at the beginning, where was that? His whole leg's on backwards now. What what happened? Right. And then you start seeing some of these slow motion, look on YouTube, look on Google, you start seeing some of these videos, and you see still pictures, and his leg is normal. And it's the rest of it.
Going the one opposite way, right? Yeah.
So I think it's come out right. They keep saying dislocation. I think a much more, in all probability, the accurate term is fracture dislocation. Right. I can't imagine he did not also break a couple bones in there while this happened. Typically, the kind of little bone on the outside of the leg and the bottom of the big bone in the tibia, and then. Even more so, more significant about him, the reports here are that it was open. So the old term would be compound fracture, but open fracture, open fracture dislocation of the ankle there live on TV.
And I think with that being said, even with the articles that are claiming it to be open, it's very similar to what you just said, is that they don't really have access to what he's saying, but based off the treatment style or the treatment timeline, if you will, he had the injury Sunday, and then I think Sunday evening or early Monday morning, he underwent surgery kind of right away.
Sunday evening, I think, late, or wee hours, whatever.
Right, yeah. So with that being said, it leads us to believe that it was open because of the urgency behind it.
Reading the tea leaves, you would think that this was probably open. Oftentimes they would, if it wasn't open, reduce it. Just line it back up, but not necessarily do the surgery right there and then in the middle of the night.
Right.
I will say that sometimes the rules change for someone like that, right? It was the professional athlete who's coming in with this really, really high profile injury.
Right.
Maybe he got surgery that night. Usually that's not the case,
right?
Unless it is open, and which is we'll talk a little bit about that, and that's a whole nother set of seriousness, a whole nother set of rules, and a whole nother set of issues.
Yeah, and I think before we go into that is just kind of the touch on this obviously is not the first time something like this has happened in the NFL. I think we've even talked about some of the previous ones. Most recently, you can talk about Dak Prescott or Chris Godwin. Dak Prescott, I think, was a couple of years ago. He had a pretty good ankle dislocation.
Well, we don't think that was open.
I don't believe so. Yeah. And then Chris Godwin also, I don't believe was open, but fracture dislocation. Took about 11 months or 10, 11 months to come back, and now he's back on the injury report with what's being termed as a leg or a fibula injury, so maybe some complications with that. Surgery maybe came back not too soon, but it was just too much for his body to handle after such a traumatic event. Yeah. And then you start having some complications, some soreness, or whatever the case is.
I wonder what is going on.
Yeah, right? Because it's also interesting because, we get our resources from the internet like anybody else who would look it up, and you read these reports on a lot of the fantasy football apps have the best injury reporting on on the internet, and it just said leg and fibula. It's oh man, that's not a good look of what could that mean?
Be going on,
right?
Yeah, right.
But and then most notably the most famous, if you will, open fracture that we've seen in the most recent years would be Alex Smith.
Recently, yeah. Joe Theismann was the original.
The original.
Right, yeah.
Happened at the same place, kind of the same time, same day of the year and everything.
Crazy, right?
Crazy timing of that lineup. But
Alex Smith, 17 surgeries later.
Yeah.
Right? Epitomizes everything you worry about.
Right.
With an open fracture.
Right.
Right. There are issues of. So I actually right before we started, I jotted down a few different considerations.
Right,
if something's open, right? What goes through. Typically, it's a trauma doc. Usually, a trauma surgeon that's handling it. But whoever the on-call doc is, wherever it is that's working. The first is there exposed bone sticking out? You got to try to get it back in. When to start antibiotics? The short answer on that is as fast as you can, right? And then, which antibiotics, and there's a whole classification that sort of guides you in terms of which antibiotic. That has to do with a lot of these other factors that we think about. Soft tissue coverage, what does that mean? So in bad or higher energy injuries, you can have like basically stripping or peeling away some of the soft tissue. And you want to know that after the surgery that you're going to be able to close things up, that it's not still going to be open or exposed. And there's been a lot of, over in the last 10 years, 15 years, there's been a lot of progress in terms of one, data. So in terms of like data collection on what to do when, and then two, some treatment options. One of the big things being like a wound vac to be able to get some sort of coverage or keep the injury or keep the bone not exposed to the environment, which typically is very bad for bone. Yeah. How much comminution, how broken up, how bad are the fragments that are in there, and to some extent related to that is how high energy was the injury, because higher energy injury, i.e. car crash, and I hate to say to some extent NFL injury.
Yeah, 100%.
Portends more comminution, portends more soft tissue stripping or like less soft tissue coverage. How dirty is the injury? Yeah. This is a factor, right? Yeah. Like did his skin tear as he was going down, or did he try to plant his foot and plant the end of his bone into the turf? Right? Like two very different scenarios. Is he in? Did it happen in salt water? Did it happen in, not for him, but like these open injuries? Like did it happen in a barn? Did it happen? These are actually literal considerations, right? In addition to that, is there an associated vascular injury? This is a big deal. Like, do you need to get in and repair an artery to keep blood flow so that this has a chance of going? And then you start thinking about like, does the soft tissue need time to heal and calm down? Are you going to cause more injury if you operate through an injury early? Do you need to do something called an external fixator? Can you put the hardware in kind of right off the bat? So lots of times when we fix a fracture such as this, you're going to fix it with plates and screws and whatnot. Sometimes the right answer is with a rod, but it depends on the situation. And do you want to put that in right away? Are you going to do a second surgery and come back and do it at a later date? Yeah. I think one of the knocks or one of the concerns for Alex Smith, 17 surgeries later, is a lot of hardware went in right off the bat, and then bacteria tends to stick to metal, tends to stick to hardware. When it does, it becomes very hard to get rid of it. Right. He had the terrible sequela of necrotizing fasciitis, right? Like
that's
just
what you don't want.
Chewing all one of the worst case scenarios there, and that's why he needed multiple washouts. He gets septic, you almost die. He needed to have multiple flaps or not even
skin grafts,
and different. And sometimes it's not just skin graft, but it's actually full thickness grafts. Like you have to take some muscle, but it's an ordeal, right? And so that's what you worry about here. Is this going to go in that direction? Probably not.
Right.
Probably not. Right. But those are all the different considerations that are running through your mind as a doc when this comes rolling in. Like, man, do we do it now? Do we wait? Do we antibiotic? Do we X-Fix? Do we put in the hardware? Do we do all these different things and become like considerations and all those other factors I just mentioned are the different factors that people consider in helping decide how to handle it.
Yeah.
With that said, we don't know what he had done. We just know it was successful.
Right. But I think that being said, too, and in regards to this specific injury, people may not appreciate how disgusting football turf can be. You think they're running around, they're sweating, there's a good chance there's going to be blood on it. They're spitting on the field. Yeah. And who knows what else that field's being used for. I mean, Lincoln Financial Field's used for Temple football games, used for a bunch of different things. So all that stuff in that earth under there is just gross. And like you said, and he's wearing cleats that who knows how old they are and what they smell like, and they're his socks and everything else.
Socks.
All these things are just avenues for some kind of bacteria or something gross to get in there, and that's why you worry about all the things that you mentioned of how important it is to get that thing in there and get it cleaned out so it doesn't have these issues.
Right.
But with that said, I think it's also something we could talk about of the emergency management of that. I think has been the hot topic, at least for me at work with all my students. We're talking about what would you do in this situation? And
Great point.
Oh, well, what do you guys think? What do we practice all the weeks of we do air casting and splinting weekly of playing the game a little bit. It's kind of splint it for the most part as it is. I don't feel comfortable trying to reduce an ankle on field. It's not my cup of tea.
Should not.
Right. I definitely wouldn't do it. splint it as is for the most part, get it in air cast. Those things are really neat, and they have a bunch of these little beads if people don't know who they are or what they are. Those black casts you see that go on the football players, they have these beads in them, and you essentially pump it up, but you pump the air out of it.
You're sucking the air out.
Sucking the air out, and the beads just form together, makes this hard cast, and it can kind of cast anything in any position how it is to keep it stable. And then you get them on the cart, ship them out, and get them out that way. But you definitely have to keep your cool in that situation, and that's something that I practice with my students. Literally, we do it once a week.
That's great.
We go through it. The last time when I did it, I don't know, it was 3 weeks ago, I think I put my shoe on the side of my toe and I made it look like my ankle was going the one way, just to practice these scenarios of how bad it could look.
Right.
And that material and that technology, if you will, for splinting, I feel like is kind of pretty neat, you know, for the average person to not understand what it is.
Right.
But yeah, definitely, it's not something I would try to reduce on field, especially if it's open, God forbid. But even if it was closed, not doing it.
You know, and I got to say, you know, I don't know what they did. They, you know, camera's off, but I suspect that the doc, when he got out there, gave a little push, and kind of got it lined up a little bit better before putting it on. And oftentimes, especially acutely before everything starts to spasm and whatnot. Sometimes they're fairly easy to reduce.
Yeah.
I'm not recommending that anybody do that who hasn't done it, who's not trained in doing it. You know, you don't want to create a second injury or create other problems, but typically it slides right on back in relatively well. Good enough to get to the hospital. You know what I mean? Yeah.
Yeah, because you don't want to. My biggest take on it was thinking of is like you said, I don't want to cause any secondary injury.
Right.
For the most
pull
part,
a big piece of turf into the wound. Or, you know.
Right. For the most part, some joints that would dislocate, I may give a try to reduce on field, like a shoulder finger.
Yeah.
And maybe a patella, and that's probably as far as it goes.
Right.
And other than that, anything else is it's been the hot topic this week already of just what would you reduce on field? And I was like, that's probably my 3. And at that, if that doesn't work, we're splinting it and sending it. It's not going to be something that we're going to try to toy with.
Yeah, which is tough for the person who is, you know, dealing with the joint or the fracture and you know, everything out of alignment. But you know, it's temporary. Just stabilize it, get rid of the shake, because that's when it really hurts. You know, and just stabilize it and get it to where they can do a better job, safer job reducing it.
Yeah. So I think we can go on to, so what's this look like in your opinion of recovery timeline? And kind of I think it's interesting, right? Because I think Cam has shook the league up a little bit in regards of just his play style. It's a little old school, little smash mouth, if you will, just run straight through people's faces.
Little. Quite.
And so now he's got this, and I was kind of talking pre-show a little bit of it's going to be a long recovery, obviously, but I think his play style isn't so much of a shifty guy. It's a straightforward guy, which could help a little bit.
I agree, yes, because he has this kind of bulldozer style.
Right.
That's a little helpful. But I feel like he is shifty.
No, I agree.
In addition, and that's part of what makes it hard probably to tackle him or to defend him. Is you don't know if he's in shifty mode or if he's in run you over mode, and neither one is great for you.
Neither one of them is a good outcome. If you don't know what's coming to hit you.
Yeah.
So I think typically you're looking at 10 to 12 months, give or take.
Yeah, that's what I was going to say.
You know,
I was going to say he's probably done for about a year.
Yeah.
You know, maybe 10 months, like you said.
Yeah.
We don't even know that he's done with surgery, right? We know he had surgery.
Correct.
We know they classified it as successful. But that might. So, what could that look like at this particular point in time? One version is they opened it up, they washed everything out, they got all the bacteria out of there. Maybe they put a wound vac to kind of with something to kind of cover it up and keep it clean and pull some additional fluid out. Maybe they closed it primarily, so they actually closed the wound. Maybe they fixed a portion of the bone. There's a medial malleolus. Sometimes you get a couple of screws that will go into there, and that's a little further away from, you know, actually it looked like when he rotated, he probably opened immediately. But you know, by putting really washing out and putting a couple of screws in, you can improve the stability, and maybe he's just splinted now. There's a pretty good chance he's got something called an X-fix on, external fixator, and so that's, you know, because you're trying to protect the area where he had the injury in the soft tissue, because you need that soft tissue coverage. You don't want, sometimes if you start messing around and doing too much surgery too soon, you get a lot of swelling, you get fracture blisters, you get skin or wound tissue breakdown, and these are all worries. Usually, if you can get to it within the first 12, 24 hours, which they did,
Right.
you can be a little more aggressive in that sense, but you still need to be careful.
Yeah.
But if you're worried about that, then you do something called an X-fix, external fixator. Pins that go through the skin away from the actual injury, so higher up on the shin bone, the tibia, down in by your heel, your calcaneus. The pins that go through the skin into the bone, and a frame that's on the outside, like that just holds everything in the right place to allow for those soft tissues to begin to heal a little bit. And it usually goes through a process where everything gets really bad over a few days, and then it starts to smooth out and get a little better over the next few days. And then you go back later on and then do your definitive fixation and do another clean out or whatever it is you're going to do. So I wonder what did he have done?
Right.
Is he in an X-fix right now? Does he have all the hardware in there? If I had to place a bet, I would guess he's X-fixed and he has another surgery on the not so distant on the horizon, the not so distant future.
Yeah, and I think that's something, again, like we won't really know until if any news reports come out about it.
Yeah, and it may never come out.
It may not, right,
like
unless someone
it's
sees
his own
him,
information.
Right, unless someone sees him with it or he gets caught out in public and gets a picture of taken or something like that.
People are blown away when they see that sometimes. Like an X-fix, you're like, what is going on
And
over
I think
there?
in regard, like we just talked about a little bit of Alex Smith, and I think there was an E60 documentary special where he had that on for a long time. He was rehabbing with it on for an extended period of time.
Oh, man.
And just seeing such hardware on someone as they're trying to do this physical activity, it's like amazing to see. It's like, holy
shocking.
cow.
How does that happen?
How does that happen? How's he doing what he's doing with that gigantic thing on his leg or whatever the case is?
Yeah.
And I think in regards to Cam's injury is that, at least for the most part, he has youth on his side, which is always good for recovery.
Huge.
And, I think his toughness or craziness, however you want to,
help.
It may help his recovery because he's probably going to push the envelope and try to come back faster than we detail in our 10 to 12 month, probably 12 months, estimate. Maybe he's coming on the earlier end of like 11 months or 10 and a half months or something crazy just because that's the kind of person he is.
He's still going to need to get that strength back though.
Yeah, 100%. And I think having that kind of strength and power is going to just obviously not happen overnight, but not be something that comes back like that quickly.
And he's at a high risk for getting arthritis down the road, but that's not like the immediate future. I will say I think he's at a fairly high risk of dealing with some stiffness, losing a little bit of ankle range of motion, and who knows how much that impacts his ability. Again, the margin of error for these guys is so small because they're just such like highly like fine-tuned specialist athletes. You lose just a little bit of your ability to push off because you have just a little bit of stiffness, and maybe you lose some of that power, and maybe that's the difference between successful back and average or can't really get it going again. Short term,
Yeah. And I think with that too is I think the body's like amazing ability to adapt and develop new movement patterns. If he does have the stiffness in his ankle, is he going to run a different way that's going to predispose him to knee injuries, hip injuries, something else that's like, oh, now, there's a weird instance of when he comes back, he's had these other injuries that keep popping up, and now all of a sudden he's getting all these injuries on his history and his career, and that totally detours his career where it could have gone.
2 or 3 of them, and then it's kind of over.
Right. And that's something hopefully you don't see happen. You always want to hope that he comes back at high level, but there's always a chance. And I think I've said it before, is that in general, the common, everyday person just thinks, oh, you got surgery, you'll be good. It's like, but we just went through a whole list of all these different complications of things that could go wrong. And someone like Alex Smith, it did happen. And he didn't just have one surgery, he had 17. So he's definitely not out of the woods yet.
And it's like, I don't know why it's always like this, but like it's sort of just like the law of nature that if you, as a doc, if you know that person or know that person's family, or if it's like more of a high profile injury, just expect everything to go wrong because it's going to. It's just how it goes. I don't know why. It's so
100%. It's just one of those things where it just, like you said, it just happens that way.
Yeah, it just happens that way. A little piece of me almost wonders, like typically they're like kind of protocols, and you stick to the kind of the rules and the protocols, and then once there's like this emotional attachment or whatnot, you're more inclined to be lenient. You know what I'm saying? To compromise on behalf of the person you so badly, like you know. And then is that what predisposes, just a few more complications for that person?
You're a little bit more aggressive, or you do a little
less. Yeah,
not something different, but you just treat it slightly different because, like you said, you have a little bit more emotional attachment to the situation, or whatever the case is.
My daughter fractured her clavicle, and then when she did, like, I would never have let a patient carry a book bag after that, but because it was my daughter, and she's like, "Oh, it doesn't hurt." Oh, okay, and then it displaces, right? Like, no, I would have said no if it wasn't my daughter, because my daughter, I didn't say no, and then we got a problem. It's just what happens.
Yep, 100%.
Right.
That's just kind of the way it works. So I think that about covers our Cam's discussion, unless you have other points to make with it.
What's your prediction?
The prediction.
When does he get back? When does he get back? How is he when
I think
he comes
back next year, obviously. It's week 8, give or take now.
Yeah.
So I think the second half of the season we'll see him again. But it's going to be interesting. I think the amount of workload or play time that he gets coming back from this injury is going to be highly dependent on the success of the Giants the first half of the season.
Yeah.
If they're 1-7 going into week 8 and he might be coming back,
they'll
probably push his return back a little bit. Or they'll just wait longer, right? But if they're playoff contention, they have a chance to make a run, he's going to have more of a willingness to come back, and they might need him a little bit more, and he might come back sooner and have more play time, and his snap count might be higher.
Right.
And I think that plays a bit of a factor, too, in this situation.
They're just going to feel like they need to lean on him a little more. Right.
But I don't think he'll be back to this style of play until the 2027 season.
I think it's a pretty good assessment right there. Yeah. I agree. I think he comes back next year. I think he still has a future as a really 100%. Good running back. I don't think his career just ended. Now, of course, we're barring infection and all these other issues. And even with that I hate to say, like, is his career in jeopardy? That's a serious injury he just had.
Yeah.
It is in jeopardy.
Yeah.
I think he's going to be okay. I think. I would say odds are, and I'm pulling this number sort of out of the sky, 70% to surety he's going to come back, still have a good career, and still, but you'd like to be closer to 100.
Right.
100%.
Yeah, without a doubt.
Exactly. And then I also agree with you that next year he's pretty good. I think his ankle still bothers him. It's not perfect. And then the following year, if he's getting back, like, that's when we really see what he can do again.
Yeah, I think so, too. And I think, like you said, again, to use the Alex Smith example, everyone thought it was going to be okay, and then he had all these problems. Yeah. Yes, he still came back, but he was definitely not as good as he obviously was at some point.
The story there is the fact that he got back on the field, right? Like, not at that point, the expectation
that took him 2 years from a 2018 injury to come back and play in 2020.
Yeah.
So, like,
and just getting back on the field
just to do it. And all the stuff that he had to go through. Hopefully, again, we hope that this isn't the case for Cam Skattebo, and he comes back just in normal fashion, no issues.
And that's I don't want to say the disaster, but that's the consequences, or that's the sequence of events that everybody fears and everybody's trying to avoid. What happened to Alex Smith, and like, you could do everything right and it could still unfold like that, unfortunately. Again, the minority, doesn't usually happen that way, but that's what you're really working towards preventing, and unfortunately for him, that's how it went. And it's just like, which is why I say for him, it was just monumental. He got back on the field, right? Like, his career was not the same. There was no way, but he got back on the field, which was extraordinary. Yeah.
So, to close out that, we're going to move down a little bit here and to our next topic, to good old Carson Wentz, from the Minnesota Vikings, going out this year with a shoulder surgery that end of the year. So, Carson Wentz had a very interesting career. Former Eagle, had a pretty good injury with his knee, had a surgery, and kind of never was the same. And what a story, right? Had that great year, injured his leg.
So good.
Team went on to win the Super Bowl without him.
Yeah.
Nick
Foles.
Nick Foles. Good. What a crazy scenario that was, right? And then after that, he goes on to the next 5 years after leaving the Eagles to start on different teams each year. So
I just heard that stat too.
The only person in the NFL to start for 6 different teams in 6 years, which is absolutely wild stat.
Right.
A little bit of an NFL journeyman, from going from like a franchise quarterback thinking he's going to be the new guy in town forever to, like I said, 6 different teams, 6 years.
Good enough.
But good enough
that
to
in
start.
Each place he can earn. He's wound up starting a few games, right? Like,
And I think, We mentioned J.J. McCarthy before with the Vikings, last year with his meniscus injury, this year with his high ankle sprain. In his time being out, Carson Wentz started 5 games, won 2 of them. But unfortunately, nature of the beast, you play football, you can get hurt.
Right.
In their game in London, he had suffered a non-throwing shoulder dislocation and toughed it out and played the rest of that game and 2 games after that.
Impressive.
But had a lot of issues. And if you ever watch any of those games, even when he played the Eagles again, he had so much bracing on his arm. It looked like again, I might not say these correctly, but he looked like he had a Sully brace on one of those neoprene with like the straps on it, and then on top of it was another one that attached to his shoulder pads, which I don't know exactly what they're called, but I call them a Douglas because that's a company that makes them, and they had that taped on. So like they was padded up and braced very to the extreme to hopefully get him out there.
Again, non-throwing arm.
Non-throwing arm, which if it was throwing arm, this discussion would never have happened because he wouldn't have been able to do it.
Yeah.
But, I think in the few articles I read about it, he was saying it's quite possibly the worst pain he's ever been in playing a football game.
Tough guy.
Yeah.
Honestly.
Yeah.
Hand it to him. Like not an easy thing to do.
No, not at all. And I think
I don't know if it was the best idea either, but
right.
Give him credit. Tough guy.
And I think if anything, he's an ultimate team player in that he bought his team more time to get the starting quarterback with J.J. McCarthy healthy again.
Yeah.
Although there was a little speculation of like that guy being hurt because there was a play in one of their games where someone came out and got tackled in the sidelines, and J.J. McCarthy does like a giant jump and like broad jumps over this guy. He's like, oh, his ankle must be pretty good if he's jumping like that.
Good,
yeah. And he was suited up. I think he was an emergency situation quarterback at that time, but good for Carson Wentz to buy that team an extra week to get that guy ready and get healthy. And
let's be honest, I think most people probably especially at first, he didn't look too bad. And I think most people were like, you know what? Maybe they caught fire in a bottle, or lightning in a bottle, right? And we see it happening across the league, right?
Mm-hmm.
Like, look at Daniel Jones. I mean, for the love of God.
Well, it's also interesting because Daniel Jones and Sam Darnold, who are also doing really good this year, were all on the Vikings at one point in time last year. And now they're all gone, and they're doing great. And the Minnesota Vikings were stuck with Carson Wentz and J.J. McCarthy. So hopefully J.J. comes back, does really well.
A lot of upside. Maybe. I hope he fulfills his potential.
But, when I saw the article about Carson Wentz, I sent you a little clip of a screenshot of the article because I just thought it was interesting in how they report these things and kind of like how we can break them down and kind of make more sense of it.
Sure.
Right? It was saying that he had a dislocated shoulder, tore his labrum, and a fractured socket in his shoulder. And I was like, oh, that
sounds bad.
Yeah, that doesn't sound too great. But to you and I, it's like, oh, yeah, we know what they're talking about.
Right. Yeah. Bony Bankheart. Right.
Right.
So we've gone through this before, but probably not in a while, right?
Yeah.
So the ball and socket joint of the shoulder, the socket is fairly shallow. The analogy frequently given is it's like a golf ball sitting on a golf tee. It's not this very deep socket like a hip joint is. And so deep in the socket, you have this rubber gasket that goes around the glenoid, around the socket, which kind of suction cups onto the ball a little bit. And if somebody dislocates the shoulder when the ball rolls off the socket, they tend to tear the labrum, that rubber gasket, off of the side of the socket. Sometimes when that happens, it's not just the labrum, not just that rubber gasket, but they knock off a piece of bone at the same time as well. Now, I will say this. Immediately, we assume bony Bankheart. They knocked off a piece of bone. Sometimes it's a really small piece of bone. Sometimes it's a moderate piece of bone. Usually, it's not a really big piece of bone.
Right.
When you hear them describe it like that, I assume they're just not knowledgeable about the situation, and it's not actually like a glenoid fracture or something where like a big piece happened.
Right.
I assume it's just a small piece, which I would say honestly not super worrisome. But I guess we don't know that for sure.
And I also would agree that it would probably be a bony Bankheart over a glenoid fracture based off the fact that they've still let him play. He still played with it. It's like, okay, I don't think you go put someone out that kind of risk with a significant glenoid fracture because that's going to be much
he's
more.
Probably going to surgery.
Right. He's going to get that fixed much sooner than just a little bit of a bony Bankheart situation, which is another reason why, to talk about shoulder dislocation a little bit is why those frequent dislocators have so much problems because they keep continually chipping bone as they go back and forth.
Wearing it away.
Wearing it down, and that golf tee gets smaller and smaller and smaller.
Yeah.
And next thing you know, you have a lot of problems down the line because you can't just magically get that golf tee to be normal size again.
It's not easy. Yeah. It's like you used the tee for a second time. You didn't realize you knocked a little piece of the tee off, and you're trying to put the ball on. It just keeps rolling off. You don't want to be there, right? And that happens. With every dislocation, you get a little closer to that point. And then sometimes all of a sudden your only hope is really to make the tee bigger, make the socket bigger, and you take a piece of bone from somewhere else or from a cadaver and add it to the side of your broken tee.
Right.
Yeah.
Oof. Doesn't sound fun at all.
And typically for a labral tear and or a bony Bankart, usually we could do that arthroscopically, sometimes with a big piece, or sometimes the angle is really hard and you actually have to open it up. But if you're going to that point where you're adding the extra bone, don't get me wrong, there are arthroscopic versions of it, but most people are going to wind up with an open surgery then. And that's neither, it isn't the worst thing in the world. Really what's most important is like getting restoration of the socket and getting it like to sit well, right? Like this nice and evenly. It may take you a little longer. Your scar might be a little bit bigger if it's open, but really what's important is getting it done appropriately.
Right.
Yeah.
And that being said too, it's like Carson Wentz is a little bit old. He's 33, 32, I think.
My gosh.
Right,
yeah, I mean that's right, but it's like, oh man, I feel like he's just getting drafted, the other day.
Yeah. And he's still young in general, a little older for the NFL age, if you will. But I think the silver lining here is that his non-throwing shoulder.
Yeah.
So he just has to get it strong. He doesn't have to worry about doing a throwing program with that shoulder. He's got to
Very
make sure
much. Yeah.
it's strong and stable, and he'll probably be a little bit braced or something along those lines throughout the remainder of his career, wherever it takes him.
Yeah.
And I think also for him, in the couple of reports I read that he's like never experienced that type of pain or discomfort or just that type of bracing to be like
limit him.
Those shoulder braces are very restrictive.
Yeah.
Because they go around your whole torso, and my biggest complaint that I see with them is that they just have trouble breathing because it's just like it goes around the ribs, but you want it to be nice and snug.
Interesting.
Because you want it to hold that shoulder joint as close to safe as you will, if you know what I mean.
Yeah.
You don't want it to be super loose because then if your shoulder's dislocating, it's going to defeat the purpose. And then you do all these different strappings and all these different things, and then you have the big old shoulder brace that attaches to your shoulder pads. So I think it was just a lot of hardware, if you will, almost that he had to deal with going into it. Now going out of surgery, he probably won't deal with that much, but at least it's not his throwing shoulder. So,
right.
But who knows what that takes him.
Was able to start on 6 different teams over the course of 6 different years. I feel like this kind of an injury, that ruins his season this year. I don't think that should ruin his career.
No,
I would be surprised if he doesn't catch on with another team next year. Who knows? Maybe he gets another chance.
Yeah. And then maybe he
and
goes
he looked
7
pretty
for 7.
good before. Yeah.
I mean, he started 5 games, won 2 of them, which I mean, I think it's hard just to come in as the backup and win games. It's it's enough to be said in that regard. But I think that's the nature of the beast, right? And being these decent veterans who have shown, and I think he got enough little clip of film this year.
Yeah.
That he has still something left in the tank.
Some gas in the tank.
Some gas in the tank, doing pretty good, and then. And who's to say next year big injuries don't go down and Carson Wentz available? You give him a call, he's on your team, and he's starting for the 7th
Joe
team.
Flacco was on a different team, so you got to go to Carson.
Right. Yeah, and I think another name that could be thrown out there would be like a Jameis Winston's going to go somewhere, maybe before the trade deadline, and we'll see. But
where is he now?
He's with the Giants.
That's what I thought.
What an interesting locker room.
I know. It's crazy.
What else do you want to? Anything else for tonight?
I don't know. I thought there was two very interesting topics. Obviously, I think the Skattebo one is really the one that captured the mind of everybody.
Joint dislocations, different areas of the body, different outcomes, different procedures.
Right.
Way different levels of severity, obviously, right?
Yeah.
Carson played 2.5 games. Cam Skattebo got surgery in like 12 hours. So
I think Carson is a tough guy. I think he played through some injuries in Philly. I think I do give him credit. He's not soft.
One thing you can't argue about. He's definitely gone through plenty of football pain and injuries, and he's prevailed and played through them and done pretty good.
Yeah, right.
So I think that wraps us up for tonight. So before we go ahead and close out our tab, we're going to give a quick shout out to some of our sponsors, Virtual Orthopedics and Spine, from runners, knee, and dog walkers hip. They have a doc for that. Yard work, back, and laptop wrist. They have a doc for that too. They have Virtual Orthopedics and Spine has over 120 providers, over 20 PT rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho. Neck of the Woods Brewing Company, serving us up the best beer in South Jersey. And lastly, Timber Real Production, helping us get this media out to all of our awesome listeners. So if you're hearing this, give a like, a follow, and a share on any social platforms. We would appreciate it, and we'll see you all next time.